Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider, is answering your COVID questions. This person says, what happens if you took the first shot of the vaccine, decided that you didn't want to take the second? Does that mean that you're still vaccinated even though you only took one shot?
So that's considered as being an incomplete vaccine. So we still recommend to finish up that series and actually get a booster.
Okay, finish up the series and get the booster. This person says, how reliable are those home tests for COVID?
I think they can be pretty reliable. And the key thing, though, is that if you're having symptoms, to repeat the test the following day or the day after versus going to get a PCR. So the accuracy improves if you do the test, a couple days apart.
Okay. This person says, I've already gotten my second J&J shot, so the booster, but I'm hearing that J&J is now not the best one. Should I go get an mRNA shot as well?
So in that scenario, we probably would recommend a booster of an mRNA, but it would still be that 6-month period.
So if they just got their J&J booster, you want them to wait 6 months and then possibly get another booster, but an mRNA?
So based on the data that just came out on Friday, is that the preference of somebody, which is a little bit different than the question you're posing. It's like I got the J&J and I'm now 2 months out wanting to get a booster. The recommendation is actually to get an mRNA vaccine. You would actually do a little bit, the antibody response is better than if you were to get the J&J vaccine.
Okay, and of course, again, like you're saying, all this could change within the next month or the next couple of weeks when we learn different things. So hold tight, you J&J person, because that question may come up again and it may be a different answer coming up in the next month or two. All right, this person says, why should I get the vaccine even though I can still get COVID?
So the vaccine, be it if you've had 2 doses or 3 doses, is that the severity of illness and decreases tremendously. And also it prevents hospitalizations. Right now, across the triad, we've had such a big increase in hospitalizations, and I believe it's like a significant increase across North Carolina. We have flu in the community. We want to keep everybody as healthy as possible. And getting the vaccine is one of those ways, as well as continuing with masking, despite not having a mask mandate.
This question is: are unvaccinated people blamed for the variant cases of COVID, or would the sickness mutate anyway?
There is. I don't like to say blame. I think what the key issue is that there wasn't enough vaccine deployment throughout everywhere, right? To countries that didn't have access to it, and also in countries that do have access to it, it's really promoting the acceptance of that vaccine, and that helps reduce the risk of mutations. Viruses often mutate, so that part is nothing new. We see that with influenza all the time, but the key thing is that we can't anticipate if it's going to be like a stronger variant. Is it going to be more lethal? But the key thing is just making sure everybody gets vaccinated. Those who need to get a booster, please get a booster now. Please keep up with the 3 Ws and have a safe holiday.